I am here to talk to you today about smoking during pregnancy and the harm it can cause you and your children. In quotations, smoking in pregnancy accounts for an estimated 20 to 30% of low birth weight babies, up to 14% of preterm deliveries, and some 10% of all infant deaths. Even apparently healthy full-term babies of smokers have been found to be born with narrowed airways and reduced lung function. That came from the American Lung Association, June 2011. As I have 2 children, and I believe most of you know that from my introduction speech, I did not smoke during either of my pregnancies. But with my last pregnancy, I did live with my ex, my son's father, where he, his sister, and his dad smoked around me all the time. Thankfully, as my child is now a 15-month-old happy baby boy and has not been affected yet, my older child now has asthma. I feel that you should care about my speech because if you are a parent and you don't care that people are smoking around your children, maybe this will change your mind. 3 main complications that I will focus on with you guys today is going to be called placenta previa, SIDS, and low birth weight. Placenta previa is the condition where what it's called when you have your placenta covering your cervix. Your cervix is where the baby comes through when you give birth, and if it's covered, it's going to be very hard for the baby to get through. According to the National Center of Biotechnology Information, the National Library of Medicine, and the National Institutes of Health, the results of an interview in the medical record data show that smoking does cause placenta previa. This is a diagram of placenta previa. On this side, on the right, you see that it's a normal pregnancy and the placenta is in the normal spot and the cervix is open. And on this side, the left, the cervix is completely covered by the placenta, making it hard for the baby to come through the birth canal. As for the next topic that I will speak about, it's called Sudden Infant Death Syndrome, also known as SIDS. And I know many of you know that that's also known as crib death. It's sometimes not preventable, but according to the CDC, SIDS is preventable to an extent. If you do not smoke around your child or during your pregnancy, you cut the chances of your child dying from SIDS. I have over here a checklist. If you really want, you can print it out off of Google so you can make sure you're doing the right things to help prevent your child from dying of SIDS. And right on that list where it says don't smoke around your baby. Very, very good advice, especially if you don't want your child coming down with asthma, because it's very, very tough for the child with asthma. I know because my older son does have it. As for low birth weight, right here on my phone, I'm sorry I didn't get a chance to print that out. You could see what a baby with low birth weight looks like. Not saying that his mother smoked, but it's possible that she did. Smoking can cause low birth weight, which can cause medical problems such as cerebral palsy and mental retardation, vision and hearing ailments, and even cause stillbirth, where your child comes out dead after you give birth to him and he doesn't even take a breath at all. If you quit smoking within the first 4 months, you cut your chances significantly of having a baby with low birth weight. And now that you are informed of the dangers of smoking during pregnancy, you can help a family member, yourself, your friends, and all these children of the future. We talked about placenta covering the cervix, known as placenta previa, SIDS, and low birth weight, where you can suffer from many other health issues. Would you or could you ever think about what it would be like to put your child to sleep just to wake up to start planning a funeral? Remember, it's never too late to quit smoking. And right here are my references. If you want more information, you can visit those websites. Have a great day, guys.